Welcome to On the Beat. Today we are sitting with our friends from Gastroenterology Associates of Columbus and Starkville, Dr. William Gillespie and Dr. Richard Hurd, and we are continuing our discussion about the liver. You both have enlightened me. I had no idea the liver played such a role in my body. One word I have heard before, but I don't know what it means, is fatty liver, if I'm diagnosed with fatty liver.
Yeah, just like fat can collect anywhere else in the body, it can also collect in the liver. But when it collects in the liver, it's very irritating to the liver and over time can cause some long-term problems.
And who would be at risk or highest risk for being diagnosed with fatty liver?
People who are overweight are one category, probably the main category, but also people who are diagnosed with some other medical issues like high blood pressure, diabetes, high cholesterol. A lot of those tend to run together.
And then what would be some of the health problems if somebody has fatty liver, they go undiagnosed? What would you expect?
Well, the fatty liver in the early stages doesn't necessarily have symptoms, doesn't cause pain or any other issues.
So you wouldn't even know?
A lot of times people have no idea they have it. But over time, it leads to inflammation, and that leads to scarring. And eventually, if your liver gets totally scarred, that's what we call cirrhosis, where your liver doesn't work anymore. And that can lead to a lot of bad health outcomes, and it's not very easy to treat. So we like to catch it before you get to that point.
So let's talk about how do we catch it. So how do we diagnose fatty liver?
A lot of people are caught just at their regular doctor follow-up visits. They will usually get some very general blood work that also tests the liver, and they'll test the liver enzymes, which we talked about on a prior segment, and they might notice that those liver enzymes are a little elevated.
So how would I treat it? I find out that I'm diagnosed with fatty liver, and how often do you see this in patients? Pretty
much every day.
Wow, okay.
A large number of our population, especially in this area, have fatty liver. There's kind of different ways to go about treating it. For a long time, the only thing we had was diet, exercise, weight loss, good control of diabetes, and cholesterol. But more recently, they've come out with the first medicine, hopefully of many, but it's the first medicine that will actually help reduce scarring and fat in the liver. And came out a few months ago, so it's still pretty new. But it is, available for treatment for certain patients with fatty liver. You do have to have an elevated liver enzymes, and you also have to have a certain amount of scarring to qualify for the medicine. But if you do, then we do have a treatment that will help reduce the possible bad outcomes from that.
And what's another way I could prevent?
Yeah, well, you want to overall be healthy, and so you want to eat well and watch your weight and control your other medical problems. You can also, if you're found to have fatty liver, we will probably suggest that you get vaccinated for other types of hepatitis, like viral hepatitis that we've talked about on prior segments, A, B, and C. And then, doing things like avoiding alcohol will also help protect your liver as well.
Very good information. Thank you both for being here. And if you have other questions for the doctor, you can check the bottom of your screen, and that will have the information for Gastroenterology Associates of Columbus and Starkville. That's today's On the Beat.